This is our third workshop with the Quality of Life Foundation Associates. And today we'll be having a conversation about creating healthy places through planning, which sort of comes out of one of our recent reports, best practice reports published by Quality of Life Foundation. And with us today, we have two of the people who were interviewed for this report. So our chair today will be Michael Chang, who is, as many of you will know, at the Office for Health Improvement and Disparities, and he's also a trustee of the Quality of Life Foundation. And then with us, the two panelists today will be Kathryn and Lourdes Madigasekera-Elliott. That's better. Lourdes is at the East Sussex County Council, and Kathryn is at the Leeds City Council. And both of these LAs have worked together with their public health and with their planning departments to bring together to sort of create healthy places. So we're going to be having a nice conversation with them. And then after that, we'll have time for questions that the associates will have a chat about, and then we'll bring all your ideas back and sort of hopefully bring together your thoughts and reflections on the session. If you haven't read the report, I'll link to it at the end, and it'll also be on our LinkedIn page. So definitely go and have a look if you haven't already. It's got lots of a nice interview set out and lots of visuals. Anyway, so these were the questions that I'll be asking associates at the end. So for you, what are two essentials for planning a healthy place? Have you seen healthy places be built through planning sort of in your own experience? And what could be the future for HIAs, which we'll be talking about in the planning? So Michael, can I see if you're around?
Yes, I'm around. Thank you.
Excellent. I'll hand over to you.
Thank you. Good afternoon, everyone. So I'm Michael Chang. I lead the Planning and Health Program at the Office for Health Improvement and Disparities, and I'll be just chairing today's kind of panel discussion before you break into your groups to discuss details of some of the issues we're going to be raising in the panel. So we've got Lourdes and Kathryn, the kind of authors or co-authors of the report with us. Just before I go into a few questions to ask them to go into a bit more depth into the issues of with the report, it'd be really useful for Kathryn and Lourdes to just give a really quick Dragon's Den kind of pitch summary, if you like, of their case study in the report before we do go any further, if that's okay with Kathryn and Lourdes. Kathryn, do you want to go first then? Just a really quick 2-minute maximum summary of your case study, and then Lourdes as well. Thank you.
Yeah, sure. Thank you, Michael. So here at Leeds City Council, our council signed the climate declaration back in 2019, and that was the impetus for us as planners. I work in planning policy and work on our Leeds local plan, which is made up of a number of documents, and we took that impetus to look at how planning could help address the targets for net zero, which the council had signed up to meet quite an ambitious target to be net zero by 2030, which it pips the national target by 20 years. We'll get there, don't know. But we wanted to look at our planning policies and specifically around that climate change agenda, and looking specifically at policies around carbon reduction, green and blue infrastructure, placemaking, sustainable infrastructure and flood risk. And a lot of those challenges, issues resonate in terms of the benefits to climate change, to the benefits of health and well-being. And we'd also set up conversations with public health around the same similar time in terms of an officer group looking at how we could make places better. So very much in sort of the focus of placemaking. And therefore we sort of were aligning those two, the process of formalising policies through the local plan, but also creating conversation and engagement through planning and public health colleagues, aligned with an officer group that was set up with colleagues in highways, urban design, active travel, planners, to sort of further that conversation and look at the benefits of creating good quality places that are meeting the benefits for health and well-being, but also the benefits of climate change.
Thank you. Good summary, and we will go into the governance structure in a bit more details after this. So thank you for the quick introduction, Kathryn. Lourdes, are you ready to give your quick summary? Thank you.
Thank you, Michael. Sounds similar to Kathryn as well. But what was the real instigator in this was our Director of Public Health, Daryl Gale, who comes from an architectural background. He did one of his annual reports back in 2020 around housing and the impact of housing on health. And it was really the housing conversation that also helped to facilitate the need to look at planning and reunite, planning with health. So I was very fortunate in that Public Health was able to get a seat at the table quite early on with our Public Health East Sussex Planning for Health group. They were very interested in engaging developers. So we have an East Sussex Developers East Sussex group looking at development. And so it was really born out of the housing agenda, as well as the fact that many of our district borough councils have declared a climate change emergency, and obviously climate change being the biggest public health risk was also a really key agenda to kind of align with. I suppose the timing as well for East Sussex off the kind of back and during the pandemic was also really important. And as horrible as COVID has been, in terms of really emphasising the needs for looking at population health management and how we're living, if we are indeed living in healthy places, was something that COVID kind of really brought to light. So, now many public health teams are looking at nationally the broader conversation off the back of the kind of COVID recovery conversation as well. So it goes hand in hand with conversations around healthy housing, healthy built infrastructure, healthy towns, natural environments, and the opportunities to kind of enjoy good, healthy lifestyles. So for East Sussex, those were the real kind of conduits, movers and shakers that have enabled us to really look at placing a great deal of energy in the planning for health agenda.
Thank you very much. So one really quick question for both Lourdes and Kathryn, and I think we all mentioned COVID a lot and what happened during and after COVID as the kind of impetus for health and the built and natural environment. I just want to get your thoughts in terms of your work, or even the councils that you worked previously to your current local authority. Is what happened before COVID? Well, we're not doing healthy homes or healthy built and natural environments, because COVID did start something, but what was happening beforehand that you think we could also learn from, as well as the good and the bad?
Thanks, Michael. We were definitely doing this before. This is not a new concept relating health to place. In fact, we don't have a governance structure within a formalised governance structure between public health and planning, but that relationship and the reason we have planning has been there since the Town and Country Planning Act was established. And that's a conversation that we had with members in terms of looking at how we could create better. It wasn't the fact that we weren't having those conversations. We didn't have the policies in place, particularly within Leeds, around design, around public realm, around green space, around active travel. Certainly those sustainability, to use the national planning framework golden thread argument, have been there for a long time. This isn't anything new, but it was very much conversations that we were having on the back of concerns raised by development plans panels, schemes that we were seeing through that were very car heavy, car orientated, weren't necessarily seen as the best examples. And I'm sure we do have some good examples that we can point to within Leeds. I'm not sort of making a disparatory general sweeping statement of development that we've got, but there was just that question mark of, can we do better? Can we improve? And I think then the impetus and the focus of COVID, with people appreciating or relying on what was local to them, made a much bigger change in terms of how we started to look at planning policies within Leeds. and started to sort of think about the 20-minute neighbourhood concept around walkability. We were having conversations with nature specialists in terms of the health and well-being value of nature, not just the sort of the biodiversity net gain conversations, but that nature connectiveness, and that all linked together in terms of creating positive, sustainable places, which isn't anything new, but I guess rebranding it and looking more at the positives around that links with positive places are healthy places.
Thank you. We go on to the kind of controversies around the 20-minute neighborhood or 15
Yeah.
minute city concept later on. Thank you. Lourdes, any thoughts from you about pre-COVID work?
Yes,
in either Sussex or, yeah, go ahead.
Thank you, Michael. Apologies because you can't see my camera. Yeah, I would absolutely echo that answer. This is not reinventing anything new. This is stuff that has existed before. I suppose the opportunity from COVID is, building on what Kathryn was saying, is there has been a greater opportunity to involve public health. There has been a greater need from those departments other than health to really engage and to help solidify those working relationships really and build upon those. So it has strengthened those other policy areas and really to make public health officers out of every department, I would say, within a local authority, from, there is no health without wealth when we're thinking about economy and regeneration. Health starts in the home in terms of housing. The opportunities around the UK Shared Prosperity Fund and town deal boards, public health are now more greater involved in those sorts of conversations. So I would say that this actually goes beyond planning and it goes beyond housing. This is just public health in terms of broader healthy places and healthy placemaking as well. So that, I think that has been a real key development, is that public health is seen as really key to a lot of this stuff now. And it's really an opportunity for public health to make public health officers out of everybody, which they already were before, but it's really kind of brought that home.
Thank you. Just in terms of my experience, before we go on to the lead on quite nicely, the next question actually is around involvement of public health in the governance structures. Definitely my experience trying to engage with public health and actually planning departments during COVID was really challenging because everyone was really focused on doing their work and quite emergency activity. So I found it quite hard to engage public health during that period of time. But then afterwards, when they began to come back into kind of mainstream activities from dealing with the COVID emergency, they were willing to engage. But definitely during COVID, it was definitely a bit more challenging. But that kind of comes to the next point around governance structures and what structures you have in place to make sure that public health and others can be involved in the conversations at the right time. The report does concentrate a lot around the governance structure of both East Sussex, Leeds, and also Oxfordshire as well. So in terms of Lourdes, then, it's great that you're able to achieve and continue to achieve so much impact at East Sussex between both the county and the district councils with your added capacity. The commonality among the 3 case studies is that the national polling policy. So nothing has really changed, but you all approach the issues in a very different way, in accordance to your different working arrangements. How much do you think, Lourdes, firstly in East Sussex, how much do you think successfully delivering on the healthy place-making agenda is down to the strength of the policy framework, and how much is it down to actually the capacity and the ability of the individuals or the teams you're working with or for in the local authorities? And what lessons can you highlight for those in both unitaries and also in 2T areas?
Yeah, that's a really great question, Michael. So yeah, I mean, the honest answer from my perspective is that the National Planning Policy Framework, as we know, it does help because at least there is a paragraph around health and well-being and the need for that. So for us, that's almost the starting point in, really trying to embed and solidify that duty to cooperate with our planning teams. So we use that as the starting point. It's by no means, it doesn't by any means do all the work for us, because how do you then put that into policy? How do you then put that into practice? How do you then develop processes to help us deliver against those ambitions? So in terms of the local context, for us, the number one key has been is really around those relationships. We're a two-tier authority, so we face challenges in a different way that a unitary authority may face some of those challenges in trying to embed healthy places. And what we're doing here is leading without authority. A lot of those powers sit outside of direct control of public health. So we're really reliant on using both the national hooks and policy levers, as well as developing our own local policy hooks and levers. And really, the gift of HIA is in some ways we'd be able to use that as the carrot in which to kind of help engage, upskill, train, build confidence around planning for health or broader healthy placemaking agenda. Some of the kind of challenges are the fact that it is huge. We don't just tackle kind of planning for health. That is just one of the things that my team lead on. And so we do have to be quite focused. And, it's not easy trying to keep abreast of all the activities and different stages that our district and boroughs councils are. So in terms of governance, we try to influence, obviously, at a county level, but also, all the way to district borough level. And even, when we're thinking about neighbourhood plans, for example, at that level as well. So we are engaged through that. And that's really about working together. It's about having the honest conversation that some of this is around, trialing, trial and error, suck it and see, try and develop these processes. And part of the mechanisms, the governance mechanisms that we've used for that is, as mentioned in the report, the Memorandum of Understanding. That actually has been a really powerful tool for us, because that solidifies how we will work together, how we will engage each other, and it sets out those expectations right from the beginning, what those joint actions and priorities might be. So having those local governance structures are really, really important, and it's nice to have the national, but it's not going to do all of the work and thinking for us.
Thank you. Kathryn, any thoughts from you?
Yeah, we're here in Leeds. We don't have that formal structure yet. I say yet, blind if I can, virtually. Between public health and planning, it's there as a relationship. We talk to each other. The head of public health comes to some meetings with the head of or chief planner. So there's conversations happen, but it's not necessarily migrated down through the different directorates and the different services. So we try to address that through setting up an officer group, but it lacks that governance. We're not reporting to anybody. And I think that's really important in terms of setting actions, setting objectives, setting that memorandum of actions or understanding, as Lourdes has just alluded to. So we are actually looking at setting a protocol up between planning and public health to address the sort of the formality of that conversation and that process. Through the local plan update work that we're progressing, we will be asking a new policy ask for HIAs. This is new for Leeds. I know it's not new for other local authorities, but it is new for us. And therefore we need to set out realistic applications, resources, who's doing what. We unfortunately are limited, and I think, as Michael sort of alluded to, during COVID, public health colleagues were quite rightly not distracted, but doing other things they needed to do in terms of public health, in terms of the reaction to that. Now that has calmed down, we're looking at that relationship and resource to actually, how do public health comment on planning applications? How will we put the HIA into practice? And so setting out a sort of a formal protocol will make sure that we've established that expectation and level of resource, both between planning and public health. So that's a positive that we're working towards as a result of highlighting the need to action a HIA.
Thank you. So just in terms of moving to the next theme around place, and something that was not mentioned actually in the Leeds case study in the report, but I was aware of it previously. So each local authority or each director of public health is required to publish an annual report, very similar to planning. We had to do an authority monitoring report. But the Leeds annual report 2014-15 on planning a healthy city actually won the best annual report award at the Association of Directors of Public Health conference. So obviously, I think Leeds get and got the the kind of issues around healthy cities. But coming back to the kind of place theme, obviously East Sussex and obviously Oxfordshire, they're quite different to Leeds and some of the other areas as well, the rural, urban, and coastal differences across the country. How do you see that kind of panning out in the work that you do? How do you reflect that place characteristics in your work, so it's not the same policies for everywhere, but very tailored to the needs of the particular place and communities? And how do you think the HIA tool can be useful in that way?
That question to me.
To you and then Lourdes.
Yeah, okay. Yeah, a really good question. Leeds is a diverse city, very urban centre, with a sort of main urban area around it, but we do have a lot of rural settlements within the sort of the greenbelt area around, and they are all different. They range in size, but the expectations of healthy place should be no different for the size of the settlement, and the issues created. If anything, I think the pressures on urban living, high densification puts greater pressure on place and the facilities that come with it. And that's why we're starting to look at the tool of 20-minute neighbourhoods to assess the walkability of places, to look at that sustainability. And the local plan looks to introduce a new policy on achieving 20-minute neighbourhoods for windfall developments. It's something that we are further advancing through our second process of local plan update, because we're not busy enough with our first, to address. And HIAs is seen very much as a sort of a process to formalise that request from developers, look at the considerations, that site assessment, look at the data that we've got within the data mill for Leeds, which is publicly accessible, and there's a good quality level of data that is there and held by public health and updated regularly. So there's no reason why developers can't start to consider these issues when they're putting forward the schemes, and there should be no difference in terms of where they are locally or geographically as to the considerations of good quality placemaking. So one of the aspects that we would started to do through the HIA is create a sort of a criteria-based assessment and sort of table. And when we started to pull this together, we were saying, actually, a lot of this is already done. A lot of our policies already address this criteria. It's just not in the form of a HIA. It's not just pulled together. So we did have, and I think we put in one of our responses to the report, there's been some resistance from the developers to say, oh, it's another piece of bureaucratic paperwork that we have to fill in when we submit a planning application. It's not the case, because actually those that are doing it properly and thoroughly are already thinking about these issues. But by having a policy ask for Leeds through a HIA actually formalises that approach and structures that process and that criteria for health-related issues, health and wellbeing issues into one place. So that's what I see as the benefit.
Thank you. Lourdes, before we move on to the last theme, thank you.
Thank you, Michael. So in East Sussex, we've also looked at what other places have done successfully, and I think that's where the MOU was born from. This MOU is I'm told is a good MOU, but it's not necessarily something new. What's really exciting, the next stage is that is absolutely trying to crack the nuts and bolts of, okay, so now you're going to have a HIA and a local plan. Well, how does that work? What does that look like? How does that impact on your ability to respond? And for me, that's where the real hard work comes from. So we've got the MOU in place, which sets that high level actions, which all of our district borough councils are signed up to in our South Downs National Park. And what we're trying to achieve here, which is the real difficult balancing act, is a consistent approach across a two-tier authority, across the patch, whilst respecting local sovereignty and recognising, as you say, development looks different in different places, and they all have different health priorities and needs. So what we're trying to do now is develop that next level of governance, but also that working process, which is through the engagement and process protocols, which is effectively an individual working agreement with each of those district borough councils and the South Downs National Park. Now that's tricky because the South Downs works across 3 authorities, that's 3 public health teams, and so we're having to find that lovely pinching point that also respects their position in engaging healthy placemaking across those 3 places. So the engagement and process protocols sets out the desire to deliver against the MOU. Otherwise, it's just a nice fluffy document, you know, very high level. And it says when you will engage public health, how we will respond to planning applications ahead of a HIA being adopted, and how we will also respond to applications, pre-apps and applications in place of a HIA. And it then goes on to say, well, when will a HIA be needed? And that's where the individual detail within each of those agreements will kind of set that out. So what we're looking at the moment is doing an audit around the range and size of development in each of those district borough councils. Where is development coming forward? What is the average number per year that we can expect from each of those places? And then we're trying to compare that to, okay, well, how do we respond? We don't want to respond to everything, and not every application will require a HIA, but we do want to focus on the top 20 most deprived places potentially across East Sussex. So that narrows it down. And we compare that to life expectancy. We're looking at also within those places housing ownership, private social accommodation, and then health and wellbeing priorities. And that's really our starting point for then saying where and when a HIA may be needed. And this is also recognising that up and down our country at the moment, sometimes the threshold for HIA is 50 or 100, and it's always set at large developments. But we're missing key opportunities where actually some of our places have got small size of development, but actually can have a big impact in an area that's very deprived, and where actually a lot of development doesn't ever take place. But because of the level of inequalities, actually a HIA would be a proportionate ask, because it might be that it's in relation to a proximity of a school or a specific sensitive area or proliferation. So those are some of the triggers that we're really trying to kind of figure out, and that's exciting but also very challenging.
Thank you. So just in terms of the final thing, then I think it's really interesting that, you know, with protocols and processes, we're beginning to move into a way of standardization. And the key thing is whether we can standardize across the country as well as across a single local authority or 2-tier like East Sussex. Because if you imagine 300 odd local planning authorities going through their own, you know, processes, are some of these things common across the country? So how do we standardize if we can? And it's very much the theme of government now. With the plan-making consultation, that's very much about standardization and digitalization of the process. And I wonder whether, very, very briefly, for Lourdes and Kathryn, we can just share your views about standardization, not just across your local authority area, but potentially consistency across the country as well, if that's useful for you and developers working in this area. Thank you.
Shall I kick off, Michael?
Yes, go ahead. Yeah, then Kathryn, thank you.
Thank you. I think standardization is quite an interesting one, isn't it? Because for us on the ground, or as officers, as practitioners, that is something that actually we see is really helpful and useful. But we have to also be mindful that politically that might not land with our politicians in our local places, because some of them sometimes like to do things differently, or they are rightfully so recognising that there are particular demands or needs in those places. So, but I do think there is something about, if we want to tackle inequalities, as that broader national issue, then there is something around consistency and standardisation. And that can be achieved obviously nationally through doing exactly what we're doing here today, which is sharing our learning, sharing best practice, not just talking about where we've been successful, but also, as the report rightly highlights, some of the challenges that each of us are facing. And by having the kind of conversation that we're having today, you know, we're building relationships. In my own experience, I'm seeing, you know, a proliferation of practitioners around healthy places and planning for health coming together and trying to achieve the same thing. But yeah, standardisation is something that as well, it would help if we can strengthen our national policy, of course, because, you know, that's kind of at the level that some of this stuff needs to be set. But it is absolutely, I would say, a bit of a balancing act. But in terms of what we can do in terms of our everyday practice, it is really about sharing how we're approaching things. And I think I've already seen plenty of examples up and down the country where that's happening regionally, for example.
Thank you, Lourdes. Kathryn, very briefly, thank you.
I don't think I've got much to add to that. Yeah, echo exactly the same. I think there are benefits in terms of standardisation, particularly from the sort of developer perspective, and that sort of, yeah, the standardisation of expectation. But I think there is that caveat, as Lourdes has just said, that there will be local prioritisation that needs to be reflected. There will be different needs, different communities, and as long as that standardisation doesn't remove that localised need and the reflection of neighbourhood, community priorities. But I think it's more about the potentially that standardisation of digital availability to access, and that's something that we are very keen to embrace within Leeds. I know that's something that the national changes to consultation to the planning reform is very keen on, is that availability and equalisation to data. So I think that's where standardisation I think lies, is the ability to have the confidence and the robustness in the data that is there, and that standardised data set across the country.
Yeah, thank you very much for that. Thank you. Enik, shall we?
Fantastic. Yeah, thank you so much. And we're going to continue that conversation about standardisation because it's part of our questions that I'm going to pop into the chat now for you. I'm going to now put you into about 4 different breakout rooms, just under 15 minutes to have a chat with each other, ask each other's reflections, stick to the questions of the here or not, whatever you'd like. And then at the end, maybe choose one person to share their reflections with the group. So here we go, enjoy.
Well, Sasha and Kathryn, and I think Sasha will probably be our best spokesperson.
Were there any takeaways from your group?
Yeah, it was really good. So I write HIAs. So I guess we were debating how useful they are and what my approach is. I think probably our key takeaways were standardized baseline would be really useful, but it's also really important to have people who can interpret the baseline correctly. So I was saying a bit about the baseline data we use and how I think it would be quite open to misinterpretation if you didn't know what you were doing. So you can't just publish a button, press a button to say baseline published and hope that that does it. You do need someone to be able to interpret it. So that was one thing. And then I guess my main thing was, my hope was that when we write HIAs, they help people like Kathryn's job, because what we do is help signpost all the other documents in the planning submission to make what could be thousands of hours of work of reading everything into a much more consolidated position. So we do a lot of signposting, and our documents are rarely more than 40 pages. We try and get them down to 25, saying this is where all this information you need to make your assessment is. We've summarized it. You only need to refer to the other documents if you really need further technical detail. So I think those are our main takeaways. We talked a bit about standardized methodology, and I said actually in my experience there isn't a huge amount of variance in methodologies across local authorities, so I think they are pretty standardized.
I think are already sort of thinking about that standardization. Yeah. Okay. Yeah, fantastic.
I think those were our takeaways.
That's great. Thank you. I think it was next group was Alice. So was there someone who was ready to talk from your group? No, okay. Oh yeah.
I think Shirley had more to say in my group, because when I was starting to say something, the time went off. Shirley and the other colleague with Lourdes, they had more to say. I think they are the ones who can report.
So it was Shirley, was it? Shirley.
Okay. Well, we discussed quite a few things. So first of all, well, we thought that planning a healthy place collaboration is important. It's important to have different professionals to speak to each other, share data and analysis to understand how to, what the priorities are, and community engagement is important as well, because a lot of times healthy places are planned by professionals, but not necessarily with the people who are using the facilities and the spaces in the local areas. And we did talk about health impact assessment as well. We talked about standardization, and we thought when it comes to standardization, we are also asking the question of what should be the role of the national government, and what should be the role of the local government. So there are things that would be good for national government to set standards on. For example, when an HIA is required, or for example, in what areas, like perhaps the most deprived areas or developments of a certain size require a health impact assessment. But then there are also local variations and things that should fit in the local context as well. So when we ask the question of standardization, we're also asking the respective responsibilities of local and national government. And also, we thought that it would be good to have some sort of consistency in the way health impact assessment are carried out, because it seems that different areas have different approaches, they have different ways of doing it. Some of them have quality assurance, some of them do not have, and it would be good to make sure that there's equality in all different areas. I'm not sure if I'm missing anything. Lourdes, do you think I'm missing? Okay, thank you.
Yeah. We had actually one more group, I think. Did anyone from that third group want to step forward?
I wonder whether Pierre can say something, because he was cut off. He had only 1 minute. So Pierre, do you want to, if he's still around, do you want to make contributions? Thank you.
Yeah, hi, can you hear me? Yeah, I'm definitely not a specialist in this area. I was just making sort of a general point about how surprising it is how little consensus there is in this area of health and healthy city and healthy place making, how deeply political it is, and there's a lot of issues. You don't have to get into sort of real libertarianism to find people who have real problems with kind of being told how to live their lives in any way, even if it makes them unhealthy. And I think the finding methods of bringing consensus into quite far-reaching changes in neighborhood design and city design is really underestimated, I think. And even though groups probably around this table would find it quite easy to have consensus about what good looks like, and we would find it sort of quite head-scratching to go, how could anyone disagree with this? I mean, our experience in Holland with, there's really interesting before and after photographs of some of the public spaces in Amsterdam, Haarlem, Rotterdam, quite a few that until relatively recently were completely occupied and directed, and the planning system was, and it surprises me because they sort of assume that Holland, since the dawn of time, has always been pedestrian focused, and it's quite interesting how difficult to reflect how difficult politically that change was to make happen. So I don't know. I just think that actually the solutions are quite easy to come to on paper and extremely difficult to make happen in reality, which is why the planning process is often seen as the bogeyman, when actually it's just reflecting political difference, which one should always respect.
Great, thank you. Did anyone else have anything that they were wanting to step forward with? No. Can I just give a massive thank you then to Michael and to Lourdes and Kathryn. Thank you so much for joining us, and to all the associates for taking part. We do have, I will be putting this recording up on our YouTube channel, and so linking that to our LinkedIn page. You can have a look at it again later if you'd like. And then also we have our September symposium coming up on September the 25th, which our associates are warmly invited to, and it'll actually be an in-person event, which will be lovely. Our next associate workshop after September will be on our theme around nature. And so that, I think, is all from me today. Thank you so much for joining us. Have a lovely rest of the afternoon.
Thank you, Nick. Thank you, everyone.
Thank you.
Bye-bye.
Thank you.
Bye.
Bye.
Bye-bye.
Bye.
Bye.
Bye.